My name is Emmett Walsh. I'm a medical herbalist at Roscore Clinic, and today we're going to talk about a medical herbalist and the role of a medical herbalist in Roscore Clinic specifically. We're going to do a series of videos on the 4 pillars of a medical practice of alternative medicine, and they are the physician stroke medical herbalist, the patient, the therapists, and the treatments and medicines. So a medical herbalist, what is a medical herbalist? A medical herbalist is a protected title which came about as a result of a long series of discussions and proposed legislation in Britain during the mid-1960s, culminating in the publication of the 1968 and enactment of the 1968 Medicines Act in Britain. And under this Act, medical herbalists were given the legal right of primary diagnosis with medical doctors, and could write 6 certs for 3 or 4 days, and had access to specific herbs which were restricted to the general population and to other therapists as well. So in Roscore Clinic, our clinic is set up as a prototype of what is desired as a functioning and effective clinic for primary care medicine. The skills required to practice at Roscore Clinic are over and above the skills required as a medical herbalist, and added specialities are required to be able to supply this or deliver this primary care model that we are working towards and working at in conjunction with Anu Healthcare, and you can check out both websites. So the first thing that happens when a person comes is we have a consultation, and in this consultation we do a full medical history. We take information regarding the problem that the person is coming with, a full medications history. We also do whatever physical examinations are required. And just to give you an idea of the type of physical examinations that we do, most of you would be familiar with the type of equipment that we have here. So here we have the blood pressure monitor, and here we have the stethoscope, so we can check blood pressure, we can listen to the heart, or we can listen to the chest, and this can also be used to listen to the tummy in an abdominal examination. Here we have the basic equipment for basic ENT examinations, ear, nose and throat. Many of you are familiar with that. Here we have a modern electronic thermometer. These 2 guys are part of nervous system examinations generally. You've seen these guys before, I'm sure. This is just a small version of the Snellen chart for an eye test. This little guy, he seems very innocent, but it's actually a very interesting piece of equipment. This is called a pulse oximeter, and we use this to check oxygen levels in specific patients, particularly those with COPD and also patients with heart failure. This also gives us a reading of the rhythm of the heart, so it can give us quite a bit of basic and very useful information with certain patients. Over here then we have a glucometer to check glucose levels in diabetics, and over here we have a nebulizer which we can use for children. This is the nose piece for children, and this is the one for adults. So we can deliver particular medicines if we have to for people with respiratory conditions. Over here we have some of the very commonly, frequently used books. This one here is the MIMS. People are very aware of this one. Gives a lot of information on medications, which is very important to consider in treating people. And also, you know, many people ask questions about their medications, so we have to be able to answer these. And This one here is one of the great classics of pharmaceutical medicine. This is the BNF, British National Formulary. This one here, if you're ever in a hospital and you see junior doctors or medical students running around the wards, you'll often see this stuck in their pocket. This is the classic Oxford Handbook of Clinical Medicine. And you know, from time to time we have to check these things, because we can't keep everything in our head. We're only human. And this is another very important book as an aid to interpreting medical data. So having done the full examination and having a good idea of what is required, having gone through, you know, the patient's nutritional information, all that type of thing, we then devise a treatment specific to each patient. And that's about it, folks.